Hi, Patty Stalker here with WestfordCAT, and I am Zoom chatting with State Representative Jim Arciero. Jim, thanks a lot for joining me today. What's going on?
Well, thank you. It's certainly an unprecedented time dealing with COVID-19, having a lot of individuals at home, a lot of individuals waiting this out, really staying healthy, making sure that we do our best to flatten the curve and not spread the virus. And a lot of my constituents that I talk to, myself and everybody else, everybody is concerned. It's a very unsettling time. But you know, since the outbreak, I think it was on about 4 weeks ago now, in Massachusetts, that the governor has put forward a number of initiatives along with the legislature to react to what's going on, to preserve our economy and to keep our citizenry safe. First and foremost, I just want to say for everybody at home, if you're sick or you're not feeling well, stay at home. Please stay at home as much as you can. Just to reiterate it, I know that the symptoms are, coughing, fever, sore throat, trouble breathing, or any of these type of symptoms happen, please call your primary care physician. Make sure to wear gloves if you have to go out to get things, and I would even recommend a mask, Patty, if you're going shopping. I know some people think that's a little bit more severe, but for me, I really think that we have to protect ourselves the best we can. Don't rub your eyes, touch your face.
I interviewed Jeff Stevens earlier, and he suggested the masks as well, and more so you don't get other people sick, because you can be
Absolutely.
asymptomatic. So that's good advice.
And avoid, unnecessary travel. If you don't have to go out, please don't. I know it can be difficult at home. My daughter turned 4 this week, and we had a birthday party for her, at the house, and we took a long walk. And a lot of her preschool classmates are having sort of book days, if you will, or story time, and so everybody's making do, and I really feel confident that we're going to get through this, but it certainly is a troubling time, and we're doing the best we can on the state level with our municipal officials, with our federal delegation, to keep people safe and to get through this.
Yeah, let's talk a little bit about that. What we hear about the federal response to this pandemic. What is the state doing?
Well, let me just run through a few things, and there are a little bit more than a few, and I guess I'm just sort of saying that, but let me take you through the timeline of what has happened. And I feel, I'm certainly like you would feel, Patty, that when it comes to information, we're all sort of drinking from a fire hose. There's so much information, so many things change. Let me tell you what's happened so far. On March 10th, the governor declared a state of emergency to handle the COVID-19 threat and outbreak, and it was a critical decision for us to be able to receive and support federal funding. On the 14th of March, the governor created the COVID Response Command Center under Secretary of Health and Human Services, Mary Lou Sudders. And so far, Mary Lou Sudders and the Command Center have been a great resource for legislators to work with. We have sometimes twice a week a conference call on updates that are happening quite rapidly. And that's been something that we've all looked to this past week, and we'll get to that later in the show. I've been working with the Governor's Command Center quite a bit in the town of Littleton. On March 18th, the governor prohibited gatherings from 25 people. That almost seems like 3 years ago. But that was subsequently reduced to 10 people. And as you know, the governor also closed all elementary and secondary schools, closed all sit-in restaurants, allowing only takeout service. So right now at this time, there still is takeout, and I would suggest to support your small businesses, but don't be surprised, especially if there is a spike, which we know there's going to be in mid-April to late April with cases, that we possibly could see those things suspended as well. On March 24th, he closed all non-essential work sites, encouraging people to work remotely, and here we are. So many people right now are sort of changing their lifestyles, changing to the neo-normal, if you will. And there's been, I would like, if you can, Patty, to be able to have that order available when the production is finished here on our update today. I think it's important for people. I've got a lot of emails and quite frankly, a lot of phone calls about essential and non-essential, and the sort of feeling that some people felt was a gray area. It's pretty specific, but there are certain industries like construction, whatnot, that still had some sort of gray areas to it. So what I've told people is in my office, and I know that you'll provide the audience at home with additional ways to reach me, either through email or cell phone. My cell phone's out there, so my normal business phone. Anything that you're having a little bit of trouble of understanding in terms of if you're essential or non-essential, give us a call and we'll talk to the governor's office to get that information to you. What I've told people essentially is that use your best judgment to protect your family, to protect yourself. If you can stay home, do it. I really can't underscore that enough.
Yeah, well, we're both lucky that we can work from home. Your wife and
exactly
as well, and yeah.
I would say to get out if you had to for essential foods, for stocking up on food and all the necessities that you need, moving forward.
So, Jim, what is the state's strategy to deal with the pandemic?
Well, right now, Patty, it's a two-prong attack to deal with COVID-19, and those two are separation and testing. Separation to prevent more cases from spreading, and testing to know who has it and who does not, to sort of assess, the situation and handle it the best we can. So separation is something everyone can deal to contribute to beating the virus. Quite frankly, if you're not interacting with others, then you're not going to get sick. And that's the way I've looked at it, to keep yourself safe, to keep your family safe, to make sure that you're keeping, 6 feet apart, you're keeping your distance. This doesn't mean you can't be social. My goodness, if I've seen more people on social media playing guitars these days or taking up instruments I never knew they had, French horns, whatever, to keep themselves occupied and busy, they're doing it. And people socially, we've kind of figured out and adapted. I've seen a lot of these Zoom cocktail parties coming up. Those become the hit. My question to you, Patty, is, and we add a little levity to this, is when we get through this, which we will, does this mean that Zoom's going to be part of our life to the point where I'm going to have to do interviews like right after I take a shower, or I'm on my way to Disney World with my daughter, or I'm in the airport? I have a feeling Big Brother will be watching forever after this, and Zoom's going to be, look, the tool's been fantastic. Look, it's free for people up to 40 minutes. They can connect with people. I had my first Zoom interview yesterday morning with Congresswoman Trahan, Senator Jamie Eldridge, and the Littleton Board of Selectmen. So that was trial by fire, and you've been fantastic getting me through this. But no, I really think that it's been a wonderful tool to use. And, so far, I think it's been very effective, and I think we're resilient, right? We're gonna get through this, and we're gonna figure out a way to make sure that we get the necessary resources to people and help people in this time. So right now, Massachusetts is working overtime, Patty, to increase the availability of tests and the amount of testing. Currently, right now, we are now testing over 3,500 people daily. And we have tested over 50,000 residents to date. That's why you're seeing this, an increase in the number of cases, as we know, are getting a better sort of understanding of the number of individuals who are infected. And nearly there's, I think, the latest figure I had, Patty, was about 9,000 cases that currently right now. But some of the things the state needs, and I throw this to my district. I've been hearing from people all of the time, either businessmen, vendors, individuals that have friendships, family members, ventilators, PPEs. The governor has been aggressive, so has members of the legislature, trying to access ventilators and PPEs, which stands for Personal Protection Equipment, from the National Strategic Reserve. We are expecting about 1,000 ventilators next week that are critical for the care of these hospitals that are in need. In addition, we are seeking additional testing equipment, masks, gloves, things to protect people on the front lines. And let me just say this. I've been in conversations with Christine Schuster from Emerson Hospital, the president, and the CEO and the CEO of Lowell General Hospital, Jody White. And really the issue is this when it comes to hospitals. There's been a ban on elective surgeries, right? Because there's this danger of spreading the virus, of people being compromised when they go for an elective surgery. So with a ban on that, that is close to 40 to 50% of the revenue coming in for hospitals. So that's gone. And on top of that, there is an increase of needs for supplies and for individuals, doctors, nurses, LPNs. So you're seeing an increase in personnel, an increase in supplies, and a decrease in revenue. So hospitals are going through a very difficult time. Right now, Lowell General had reported that they're going to have to, lay off a number of people for a period of time until we get through the COVID. I'm not sure about Emerson Hospital, but hospitals are doing their best, to keep people healthy, to treat people. But right now, certainly the revenues are scary, and the lack of PPEs and ventilators is starting to pick up now. I mean, the lack, of course, was there, but it's starting to pick up now. That makes me feel a lot more confident moving forward. Hospitals and facility beds, critical to handling the sick, and obviously we're making sure that there's overflow stations throughout the Commonwealth. Right now, there's going to be one in Cape Cod. There's one. I'll tell you right now that some folks on the front lines in public safety in one of the towns in my district. I talked to Secretary Turco from the Secretary of Public Safety for the governor, and was able to get a lot of my first responders tested that were concerned about, COVID-19 and if they had contracted it. So Lori Trahan now, at a conversation yesterday, is talking a little bit about possibly having an overflow hospital in the Merrimack Valley. And this is there to be, certainly a life raft or a safety net, if you will, for the hospitals that are really going to be bursting at the seams. The goal of the Commonwealth also is to increase supply by 1,000 to deal with the anticipated surge, like I said, and those places in Worcester and Cape Cod and eventually Merrimack Valley will help. So I think the 50% loss of revenue from the hospitals through elective surgeries and the surge of patients is going to be a difficult challenge moving forward, and those overflow hospitals are going to be more important than ever.
Jim, what is the state doing to help individuals and small businesses during this shutdown?
Well, I would say first and foremost, during the pandemic, I have had probably more phone calls on unemployment issues, on small business issues, small business loans, trying to make ends meet when literally there's a shutdown. And businesses, although they're doing, some small businesses are able to work remotely. A lot of, Main Street businesses, a lot of, eateries and restaurants, they're trying to work on takeout. But like we talked at the top of the show, Patty, it's just not enough to make ends meet. It's scary stuff. And I've talked to, again, so many small business owners and so many people that they're unsure what they're going to do. So one of the things we established right away, the governor established right away, was a small business loan program. And that's $20 million for small business loans to assist those businesses hurt by the economic impact of the shutdown. I would encourage small businesses that, to go to the portal. There's a small business portal that's on the state website that will help you navigate through there to apply for it. I also would recommend, and this is what I've received from some of the staff members of the business lobby in Massachusetts, the Associated Industries of Massachusetts, AIM, in particular, Brad McDougall, great friend. He's the vice president who I've actually had talked to a number of small business owners in Westford to help guide them and navigate them through other additional options. One of his big recommendations, Patty, was number one, to go to the portal on the state website, to look towards emergency capital. It would be up to $75,000 for businesses with 50 employees or less. The terms would be no payments due for the first 6 months, then 30 months of pay of principal and interest, no penalties for prepayments. And a lot of that also, I think, is important. And some of the advice that I've heard is for small businesses also to talk to your banks. A lot of the banks know through the federal government and through the state government, there is going to be a small business relief loan program. And talk to the banks that you do business with if you haven't already. And they're going to be anticipating, these changes coming from the federal and the state government, and to make sure that you take advantage of those. The loans available through the Massachusetts Growth Capital Corporation. To apply, go to MGCC's website, Empowering Small Business. I think that's a very important resource to make sure that you have appropriate, avenues and different resources to use for your business. Mortgages. This is, we talked a little bit about how we can help small businesses, but also for individuals. So when the, essentially the lockdown happens and the COVID virus continues to spread and people are staying home, there's a lot of anxiety over paying the bills. And one of those, the Massachusetts Division of Banks just recently asked financial institutions and lenders in Massachusetts to, number one, postpone all foreclosures for 60 days, forbearing mortgage payments for 60 or more days from their due date, waive late fees, online payment fees for a period of 60 days as well, not to report late payments to credit rating agencies for 60 days. And this is, as there's such a loss of revenue here. There's such an anxiety of individuals figuring out how to pay to make ends meet. So the Mass Division of Banks is asking a lot of private institutions and credit rating agencies to certainly look at this situation and give 60 days for individuals who are trying to pay bills, and also allow borrowers an additional 60-day grace period to complete loan modifications. Another is the sales, meals, and room occupancy taxes. So what about taxes, right? April 15th is around the corner. People are very concerned. Sales, meals, and room occupancy taxes from small businesses, they have to have a specific date to pay those as well. And that is going to be changed to June 20th. So I think the important thing to know here is that if you're a business that's making more than $150,000 and you're receiving, meals and room occupancy taxes, your date's going to be the same. It's going to be June 20th. But if you're making far more than that, you would have to talk to Department of Revenue or talk to my office to figure out exactly what those dates would be. And the state income tax filing deadline, I just alluded to that. That has been postponed, like I said, from April 15th to July 15th for individuals and businesses to match the postponement at the federal level. Unemployment. In regards to unemployment in our state, we were in good position before the crisis. 3.5% unemployment in Massachusetts and pretty solid state revenues. Everything has changed. We went from, we have a $4 billion reserve in the Massachusetts state. And now, moving forward, when our budget process is going to come, typically around, a few weeks from now, the House of Representatives starts its debate on the budget. And, as our fiscal year, every fiscal year by Constitution, we have to have a balanced budget, Patty. And we will have that again this year, but July 31st is our date to do that. And I feel like everything's somewhat in flux right now. As the social and economic shutdown of this pandemic takes hold, there will be thousands upon thousands of unemployment claims filed, and there are currently. In order to assist people, we have waived the 1 week waiting period so that individuals can apply right away to receive benefits. So anyone who's had to, unfortunately, file for unemployment insurance before, there's usually a period of time, usually a week, a little bit longer, where you get approved, and that's been waived to help people get the money they need right away. The federal assistance for unemployment, the CARE Act, will help with unemployment as well, mostly in two ways. First, the federal funding will go to these individuals who are self-employed and those employed as independent contractors, the so-called 1099 employees. These two groups are not typically covered by the state's unemployment system or the unemployment insurance. And it's my understanding that a separate system will be set up for filing for this funding, and we are waiting for the guidelines from the federal government very soon. And also the federal government is supplementing, the state's unemployment system by contributing an additional $600 weekly per claimant for the next 4 months. And also on the federal level, a check in the amount of $1,200 is being sent from the feds for each adult, and an extra $500 per child, which will come through an automatic tax refund system for those people who file that way, or otherwise it will be mailed. And the exact date for disbursement is currently still being determined. But I would say also take a look at the unemployment portal that Governor Baker has put forward. It's helpful to make sure that you get, and if you have those needs, that your resources are there for you. If you're having any trouble with that, please contact my office. That would be something that I would be happy to help you navigate through. A couple things on housing too. Evictions have been suspended. Rental assistance has been increased by $5 million, and rental assistance terminations have been put on hold, so people aren't being thrown out because they can't get out to work and make money. New guidelines have been issued to financial institutions and lenders, urge them to provide relief to borrowers, and advocating for a 60-day stay on those facing mortgage foreclosures. Professional licensures. I had a number of calls from individuals about professional licensures. Essentially, professional licenses, those in good standing, have been extended until 90 days after the end of the public health emergency. So, you have a professional, massage therapy, or you have a license in any kind of trades, etc., professional license, and expires during the period of time that, you need to either test for it, or there's something that you can't do remotely. That will be extended for another 90 days after this pandemic. And senior shopping. Right now, I think that's been something the governor has ordered grocery stores and pharmacies to offer seniors those shopping. And I know that, Jeff Stevens has just been a great resource for me too about what's going locally. He's talked a little bit about this too, but I believe it's 6 a.m. to 7 a.m. at Market Basket is specific to senior shopping. I don't know what Whole Foods was. We tried to find out. I don't know if Whole Foods had a specific senior shopping in the morning. I'm sure they did. Something very similar. But at the moment, I didn't have the hours of Whole Foods. Like most Westford residents, I think we shop at Whole Foods for specialty items, and Market Basket's our go-to, right?
Right.
Student loans. And this is something else in debt. And this is more on the federal level, but right now the Trump administration had announced that they're waiving all interest on federal student loans owned by the U.S. Department of Education for at least 60 days. Additionally, borrowers will have the option to stop making payments for at least 2 months by requesting an administrative forbearance. If borrowers choose to continue making payments during the COVID-19 interest waiver period, those payments will be fully applied to loan principal once any interest that was outstanding as of March 13th is paid off. So for borrowers with defaulted federal student loans, that's another issue that I've had a few constituents talk about. The U.S. Department of Education is also stopping involuntary collection activities for a period of at least 60 days too. So it's a lot of information, but it's very important. And if there's, again, I'm just going to keep saying it throughout the show, there's a lot of stuff that's on the federal level too that I thought was important for you to know. I would be happy to work with Lori Trahan's office to get you those, get the resources that you need, and someone to talk to if you need that too. And I think that's a frustrating thing as well. Right now,
people don't know where to turn. They don't.
Well, state government is out straight, if you will.
Yep.
And I'll tell you, it's been like drinking from a fire hose when it comes to constituent services. I'm on the phone early in the morning to late at night, and it's just like anything. It's our job, and I'm happy to do it. But there's a lot of anxiety out there. There's a lot of fear financially, and there's a lot of fear on health as well.
So what is the legislature doing specifically, Jim?
Sure. Well, it's an interesting time, right? We can't meet in formal sessions right now. So every 72 hours, Patty, we have to constitutionally meet in the legislature. The House and the Senate have to, by Constitution, we meet informally Mondays and Thursdays. And then sometimes we can open, and, for the rules of the House, and you can have informals and other days as well. We're still filing. There's more than 50 different bills to address various aspects of the COVID-19 crisis, which is spearheading our legislative efforts, right now, reviewing so many of these bills. But I'll say this, it's been difficult. I've had some, interest groups that have reached out to me, wanted to know my position on, like 15 bills that were filed 2 days ago. My priority right now is from the people, the sick in Middlesex. It's my constituents in Westford, Littleton, and Chelmsford. And with that, it's been very difficult to focus on much else, but helping small businesses get the resources they need, by helping people file for employment, for helping, isolated individuals that we've had that needed, food and supplies, et cetera. And let me give a shout out to Westford COA, to Nancy Cook, Jennifer Claro. They've been wonderful making sure that we get the resources to seniors. But personally, a piece of legislation that I filed, really, it's going on probably 3-4 weeks ago now, that I'm very, very happy is going to be getting a hearing this Monday, is House Bill 4611. It's a bill I personally filed. The bill essentially protects first responders who are on the front lines of this crisis and who must deal with, a various and a multitude of public safety issues. And it covers individuals employed in police, fire, correction officers, dispatchers, emergency medical technicians, paramedics, nursing professionals, any person in that group who has symptoms or contracted COVID-19 and is hospitalized, quarantined, or required to be self-quarantined because of this infection, or, in so many cases comes into contact with someone with the infection, they'll have their time of incapacity or inability to perform their regular duties considered as regular on-time duty. What does that mean? It means that our first responders, Patty, they're the first ones, as I said, to handle issues, to care for sick people, to really be on the front lines of COVID-19. And they're, I would say, some of the first people to have that unfortunate situation to contract COVID-19. So we need to protect their benefits, their sick time, right? Their vacation time. And if they were to contract COVID-19, God forbid, I really would think that we need to make sure that they're not burning through their sick time and their vacation time to be able to get better and perform their duties. So that legislation, I'm very confident, is moving forward. I have over 50 co-sponsors. A number of police and fire unions have been advocating strongly for my legislation. And this Monday, we have a public hearing at 1 p.m. And I have to admit, I'm in uncharted water, Patty. I don't know how we're doing this because it is the public hearing. We've written testimony. I believe we'll be sending virtual testimony as well. But it's an interesting time. It's something we're all not used to. We had a conference call the other day with Speaker DeLeo, and it was literally 130 legislators on the phone. And questions were asked, and we're going to, moving forward, we're going to have, smaller groups of the members. It's 160 members, right? 130 Democratic caucus. And there's been a number of proposals of how moving forward, we're going to be voting on bigger bills. Right now, an informal session, unless someone objects to the legislation, then the bill can move forward. And both in the House and the Senate, typically informal sessions are used to move the business of government. to move bills that, for instance, a home rule petition for, the town of Westford for a liquor license expansion, or something that town meeting voted for, a land acquisition, et cetera. That's usually typically what informal session is a lot of the action that is done there. But now we're talking about for some of our bigger pieces of legislation that's going to be coming down the pipeline. How are we going to vote? There's been some proposals that maybe a group of us spread out in different divisions. And if you know from the House of Representatives, there's 160 of us and there's 4 divisions. Maybe there's 10 people in each division spread out. This is all uncharted territory for all of us. So I have to figure out how Monday is going to go before I can even think about bigger pieces of legislation being filed. But I'm very confident the support we have to get back to my first responders bill. It's incredibly important. I alluded to it before, but there's also, first responders I know of right now in my district who have contracted COVID-19, and others that need to be tested. Just yesterday, I had to make sure that I could expedite the testing and get a number of first responders out to Shrewsbury to get tested to protect their community in the town of Littleton. So it's absolutely imperative that we get this legislation for our first responders. It's really important that we protect them, the work they do for us, and their families. So there's a few other pieces of legislation I wanted to touch base on that the House had passed just this week. And a lot of it is cities and towns have been asking for more flexibility, delaying local elections and town meetings. I think Westford just voted Tuesday night to move their election to June.
June 30th, I believe.
June 30th. Delaying local elections and town meetings is very important for, hopefully we can start to, get a little bit of normalcy as time goes by and we get through the surge in mid to late April. But there's, this is all new to everybody. And each and every day, we hope that's the case. But towns need flexibility for local elections and town meetings and how things are going to have to change and be fluid moving forward. Also modifying local permitting processes. That has to do with certain construction sites, et cetera. They might have pulled permits for certain projects, et cetera, and they need to have, that flexibility as well. We talked about extending the tax deadline. Also, there's going to be a number of education changes, extended certain K through 12 education requirements. And also one of them was allowing retired municipal workers to work during the emergency, because it's all hands on deck. It really is. And if there's people that can help, I really think that they really need to be able to give that flexibility to let, retired individuals work for the town as well. Personally, like I've said, I've been working with my staff to deal with, constituents who call every day and email every day, early in the morning till late at night. And they get me on Facebook too. And that's why I do my best. So just to bear with everybody, you'll probably see this on Facebook later, but I do my best to get some, I always, if you can flash my email up there, Patty, that would be a little bit more helpful. Some people think, hey, Jim, I commented on one of your stories. Why didn't you get back to me yet? I'm like, I do the best I can, but I'm human. I miss things too. Again, there's been a wide variety of issues that people have called me about, and we're doing the best we can. And I have 2 legislative, a chief of staff and a legislative aide. Josh Hendricks is my legislative aide. He's working remotely too, but he's getting back to people the best he can. And Jeff Tucker, my trusty chief of staff, who many people in the community know very well, is working remotely as well and doing the best to get back to constituents in a timely manner. So bear with us. Again, I keep saying this, we've been somewhat drinking from a fire hose and it's a lot of information, and I apologize to the people at home how much information this was, but I think it's important that people know about the options they have financially, know about the options as small business owners, unemployment, you know, things that we take for granted right now. Certainly things are very fluid, and things that we take for granted are not as easily attainable as they used to be. So until we get through this, which I'm confident we will, I know there's a lot of anxiety out there, but we're going to get through this. And a lot of it is going to be social distancing, testing, and making sure we flatten the curve.
So Jim, can you tell us a little bit about what is happening at the Life Care Center in Littleton?
Well, it's a very unfortunate situation, Patty. On Wednesday morning, I received a phone call from Chief Matt Pinard, the Littleton police chief, that there was a situation that was sort of out of control at the Life Care Center of Neshoba Valley in Littleton. And that was from the period of last weekend, Friday, to that Wednesday morning that I received a phone call. There were 5 COVID-related deaths in an outbreak of COVID-19 at the Life Care Center. So the first responders were really exacerbated by the whole point of making 17 trips to the center in those 4 days, and not really getting a transparent approach from the staff, the senior staff at the Life Care Center in Littleton. And then I received a phone call that they needed more help. When they were entering the Life Care Center, there were residents and employees that in some cases were in tears looking for help. And then there was upper management giving us a different sort of communication. So we worked together as a team with the Littleton Board of Selectmen, the Littleton First Responders, and State Senator Jamie Eldridge and Congressman Lori Trahan to really get our arms around what's going on there. Now, there's limitations with things and frustrations that we can do, Patty, because it's a private organization. But our feeling is there's lives at stake here. There's 5 people that have died in 4 days. You need to give us all the information we need to help people that are there. We've heard from a number of residents that were there too, that some of the employees there were not practicing social distancing, were not wearing their PPEs. That's disturbing stuff. I mean, this is stuff that we've heard at the Holyoke Soldier Home now, with 18 deaths at the Holyoke Soldier Home, that there were staff members that were actually ridiculed for wearing some of the PPE equipment. So we wanted to make sure that we protect human life at this institution, and we didn't feel that we were getting answers from the Life Care Center of Neshoba Valley's Littleton office. And to this date, 18 individuals were tested positive for COVID-19. And through the help of Congressman Lori Trahan and State Senator Jamie Eldridge, we were able to send a National Guard unit there just today to move forward with testing. But it's something that's very disappointing to me. And quite frankly, these are human beings. These are people's brothers, sisters, mothers and fathers, loved ones. And we weren't really getting the communication that we needed to. And let me just say also, we didn't see much of a plan to deal with COVID-19 there as well. So we're in communication with the Attorney General's office, Maura Healey's office as well. And we're not going to go lightly on this. And we're going to make sure that the people at the Life Care Center, the residents that are there, the employees that are there, the nurses, and the LPNs are protected. Today, we're going to get an update later today, and probably in my next broadcast, Patty, I'll give you an update of what's going on at that facility.
Great. Thanks a lot for that update, Jim.
Lately, you can pick up every single day. I do a COVID-19 update on my Facebook page, and it's been well received. So I'm trying to get people that are Facebook friends with me or publicly that are on social media updates too, so you can get it quicker. But please, Patty, we're going to try to do this more frequently to give people updates. I know most of my updates probably won't be this long with this much information, because certainly there was a lot to cover in this last 3.5 weeks of information. So I wanted to get it out there as a resource for people, but I think we're going to have our updates will be a little more concise.
Okay.
And most likely, it'll have a little less information.
Well, this was definitely information that was needed. So I appreciate you taking this much time to get the word out there. And thanks for all that you're doing. I know it's a tough time for everyone. So thanks for the encouraging words and all the help.
No, I appreciate you doing this. I know that you've changed everything, the way you're doing business too. And WestfordCAT, luckily, has been, right there by everyone's side through the last 4 weeks to give them, the resources they need, the information they need. And you guys do a tremendous job. You're a model for the rest of the state. So I just really appreciate everything you've done. And this is going to be, hey, we're going to do what we have to do to get through this, and we will. And, hopefully we're not doing Zoom updates all the time. We can go back to
I kind of like this.
They're not bad, right? I mean, we can go back to the studio again,
Sure.
Once things settle down a little bit. But I could just say for myself, for my family, to yours, and to everyone else, stay home. If you have to go out, I would recommend you wear a mask if you're going to go shopping, and you're going and wear gloves. That's just my recommendation. That's not an order right now, but look, we got to do everything to protect ourselves and the curve, to flatten the curve and make sure that we're not, continuing this outbreak with people we meet and touch if we're not protecting ourselves.
Great advice. State Representative Jim Arciero, thanks for joining me today on WestfordCAT. I'm Patty Stalker. We'll see you next time.